eligible for both MLA, Medical Library Association, and Certified Health Education Specialist continuing education hours. You'll be able to claim your CE through the evaluation link that'll automatically open in the window when you exit out of the session today. We're also going to put the link to that in the chat box at the end of class for you. And so with the evaluation, your feedback really matters to us, and we hope to improve future training. So please take a moment at the end of the session to complete it. So before we get into our class content, I'd like to share a few words about who we are. So you may be familiar with these acronyms, but not sure how they really relate to each other. The NLM, the National Library of Medicine, is one of 27 institutes and offices of the National Institute of Health. The NLM is the world's largest biomedical library and produces online resources like PubMed and MedlinePlus. Then we have the NNLM, the Network of National Library of Medicine, which is the outreach program of the NLM. We work to ensure health professionals and public health and the public have equal access to health information. So the NNLM is made up of 7 regional medical libraries, 4 national centers, and 4 national offices, all providing training, funding, and engagement opportunities to cover over 9,000 member organizations. So if you'd like to learn more about us, you can check out our website at nnlm.gov. So we have 3 objectives for our class today. So those objectives are going to be recognize the difference between data sets and statistics, understand a 4-step process used to locate relevant health statistics for a particular circumstance or issue, and identify online resources that provide health statistics at the national, state, and local level. So we're not going to be doing any math today or talking about how to calculate statistics today. Instead, we'll be focused on how to locate and select health statistics that are available online through free and high-quality resources. And so the class resources, we have a few resources to share with you. If you weren't able to download these, we'll be putting the links to these in the chat as well. The presentation slides will also be made available for your reference. There's an online table which lists the resources we're covering today and indicates which statistics are available, which types of data are available in each one. And there's also a guided handout that you can use during this class, which includes a few of the questions that we'll address. And then for our agenda today for the next hour or so, we'll do a brief overview of data and statistics and their uses. We'll talk about the steps to finding relevant health statistics and take some time to do a guided exercise together. And then we'll spend the majority of our time exploring several resources through the live demonstrations. And you can either choose just to watch the demos or follow along on your own device. And then we'll finally wrap up and do a part 2 of our guided exercise if there's time at the end. So with that, we'll move on to the class content. So data versus statistics. A good way to start talking about data and statistics is to define what they are and what they're not. Data is the raw numbers or individual amount counts of something. They haven't been processed, cleaned, or organized in any way. A data set is a collection of data maintained in an organized form or according to a particular criteria. Then we have statistics, which are data that's been analyzed or summarized in a way that makes it actionable and helps us to answer questions like how much or how many. So much of the health information that we see reported is in the statistic form. It can be presented in a variety of ways, such as percents, graphs, tables, figures, or maps. So some key features of health statistics. A textbook definition of statistics is a numerical summary of measures computed on samples. So health statistics are a numerical summary of data that characterizes the health of a population and the influences that affect that population's health. A population could be the entire United States, a region, a city, etc., a specific community. Parameters are different values that are describes characteristics of a population, such as birth rate, disease prevalence, or education level. Because you can almost never measure an entire population, we take representative samples and analyze them to estimate these parameters. So samples are often collected over a specified period and are large enough to conduct an adequate analysis. While there are many important uses of health statistics, which we'll touch on in the next slide, it's important to remember that statistics are collected to meet the needs of the collector. So this can mean that they're influenced by the collector's perspectives or bias. It can also affect what data is gathered and what outcomes are actually reported. So always look for notes that describe the reasons for the methods for data collection, and be sure to review them carefully. It's good to remember that information on a topic may be collected in different ways in different surveys, and estimates of the same statistic might vary between those surveys. So for example, there are multiple surveys that measure cigarette use. While each provides statistics on the same topic, the estimates of cigarette use may differ between them because they use different methodologies, sampling frames, questionnaires, or definitions. So uses of health statistics. Health statistics are a form of evidence. They can be used in many different ways. They provide information about the health of a population, what it influences. While statistics are population-based, they can help an individual understand where they fit within the larger context of their community. And they can identify health disparities that exist between different community subgroups. Statistics are used to track and monitor trends in health status and healthcare delivery, as we've certainly seen during the pandemic. Statistics can also be used to guide research, policy, program development, and evaluate effectiveness and impact of those programs. So for instance, they allow us to determine the need and significance of a research study. We can identify a policy that may need to be created or revised. We can shape how our program's resources are allocated and help us understand if a program is improving health. So steps to finding health statistics. So let's probably talk about how to find those health statistics using this four-step process, and this is on your handout as well. So the first step is to formulate a question. You may want to consider the age range, geography, time frame that you need this statistic for. So an example of this would be what percentage of those over 18 reported having coronary heart disease in Vermont in 2019? Another example is the rural distribution of the geriatric population in the United States. Has it changed in the last decade? So the second step is going to be to choose the resource to best answer your question by thinking who might collect that information, who might collect that data to produce or publish the statistic that you're interested in. So think about federal agencies, state or local organizations, or institutions tied to the subject of your search. The online table we shared will help you with this step as well. So after you've decided to use which resources you're going to use, you've performed your search, the third step is to evaluate what you found. Is it appropriate and sufficient to answer your question? And then the fourth step is to repeat as needed, either for additional information or for a different question entirely. So if you look at your guided exercise, the handout, this asks you uh, using step 1 through 4 of a process, formulate a question for a health statistic you are interested in finding today, and write that down on your handout. So depending on the statistic you're trying to find, you may want to include things like age range, geography, and time frame into your question. So I've shared those example questions that I came up with, and they're in the chat for you to reference. So take a couple minutes to think over this and come up with your own question that you want to. Does anyone have any questions about that process, about the first step of the process of coming up with the questions? And again, feel free to put those in the chat if you have any questions about that. And again, we'll try and go over this a little bit more if we have time at the end too. If we go along, again, if you have any questions, feel free to drop those in the chat. But we're going to start looking at our key resources now. So we'll start looking at some statistic portals. And again, you can choose to either watch, just follow along with the demos, or you can follow along on your own device as we explore these. And feel free to make notes in your handout that might help you answer the statistical question that you formulated. So we'll begin with our first two portals. The first one is going to be National Center for Health Statistics, or the NCHS. The NCHS is the nation's principal health statistics agency and has been a part of the CDC and Center for Disease Control and Prevention since 1987. So they compile health statistics from different data that they collect to help guide decisions on things like policy initiatives, healthcare systems, and health disparities. So being a federal agency, the NCHS is required to adhere to certain quality guidelines, like using the best available science and statistical methods, being transparent about the data and methods they use, and ensuring information is presented in a way that's comprehensive, informative, and understandable. So I'm going to go to the website now, and you can follow along at the URL shown at the bottom right down here, the cdc.gov/NCHS. Let me share my screen again. Okay, so you should be looking at the homepage for the NCHS. Apologies, my computer is freezing on me. Okay, so we're going to start with the home page, and you can start up at the top, and you can simply start looking for a particular statistic by typing into the search box up at the top right-hand corner. But I want to highlight some of the different features of this site, so we'll pull up statistics as we navigate around the resource. So up at the top here, you can see the section. There's latest on COVID-19 data. It also highlights new data files and resources or reports that are coming available. If we scroll further down here, you can see the What's New section on the left-hand side of the screen. They always have like a new stat of the day that they post up every day. You can look through that information. And there's also links to different content for different user groups. So the NCHS conducts a number of different surveys to acquire their data, and you'll find these by scrolling up, back up to the top just a little bit further here. For data collection systems. So this section right here, I'll click on data collection systems, and then we'll look at population surveys. So here we can see the title of each of the surveys, as well as the data source and methods that are used. And this tells us where the data is coming from, how it was acquired, and then selected data items, which gives us an idea of the type of information that you'd find on the survey. And so we go back to the home page. And some of the survey information is extremely timely. So if we look at vital records and then go to vital statistics rapid release, if we scroll down here, scroll down a little bit further, this program uses provisional data to estimate important statistics for public health surveillance much faster than would be possible using final annual data. This has been incredibly important during the pandemic as we've been concerned about what kind of impact it's having on things like mental health, vaccinations, cancer treatments. Having this information sooner allows us to act on it sooner. So I'm going to scroll down to the vital statistics rapid release and then surveillance activity. And then we'll look at the provisional drug overdose death counts. So this has received a lot of attention as the data showed a large increase in the number of people who died from drug overdoses in the previous year. We'll take a look at this. Let me scroll down and we can look at this dashboard here. You can view trends over time nationally and in each state. You can hover over the states to find state-specific information. And then further down, there's technical notes, which will detail information about how the data was compiled. So if you scroll over here, you can look at state-specific information if you like. And I'll go ahead and go back to the home page. So up at the top in NCHS, we'll go back to the home page. So NCHS has another way to track national data trends with a brand new Health United States website. And I'm actually going to type that into the search bar up here so we can find that. So this information has been reported for the last 44 years, and the latest the latest redesign is making it easier for users to access key findings, featured charts, and trend analysis for over 23 topics. So we scroll down here, we can actually see a full list of topics. And these things look at things like health status and determinants of health, healthcare utilization, resources, and other popular health topics. So once more, going back to the home page. The NCHS disseminates information that they create through reports and other publications. And so one of the ones that I want to show you are their data briefs. So we'll scroll back down here and we'll look at publications. And then they have data briefs. So these are short reports sharing statistics from surveys that we just looked at. You can see these by topic, year, and survey used. And I'll just open up one of these for an example. And the important statistics can be found in the key findings section right up at the top. And they provide a PDF version of the brief and as well as like several different data visualizations that are great ways to show, engaging ways to show key statistical information, whether it's through presentation or through social media. And then again, back on the home page, the next section that we're going to look at, and though we're focusing on statistics today rather than data in this class, I do want to point out that the data sets are made publicly available by NCHS, and you can find those where it says data and tools. And then under data access, you can click on that and it will show you what is available, made publicly available. Under this section here is also where you can find the stats of the states. So it's over on the far right-hand side under visualizations. And so with this, you can click on any of the states and find key health indicators, as well as birth and death information. And all the hyperlinks will take you to a national map visualizing how your state fits into it overall. So you can click on your state and find out state-specific information with this. We're actually going to go ahead and I do want to say that there's so much information on this site. I really encourage you to spend some time exploring it after the class if you can. At the bottom of the home page, you can actually scroll all the way to the bottom and sign up for an email newsletter, and it'll tell you exactly which one is, you can sign up for different ones for which visualization or which states are getting updated, and you can sign up for that information. So we're actually going to move on to MedlinePlus as our second portal that we go through here. So with MedlinePlus, this is the National Library of Medicine's consumer health portal. This links to information on diseases, conditions, wellness issues, drugs and supplements, and medical tests from select organizations. So you can use the health topics at the top of the page to quickly access statistics on a particular topic. So let's see, we can find this, we click on health topics here. It'll give us an alphabetical list, A to Z list for everything. And today we're going to look at, I'm interested in cancers, so I'll actually select this and look through MedlinePlus for this. So this takes a list takes us to a list of all the cancer-related topic pages that are available. And I'm going to scroll down to find breast cancer, and that's kind of down here at the bottom. And so we'll look at breast cancer. So there's several, if these top boxes, this box at the top, there's a sort of a table of contents. So if you look under this part, research, and then it has statistics and research listed. There's several different statistics resources listed here. You'll see the names of organizations providing information in parentheses. So you can see that there's breast cancer statistics from the CDC or the National Cancer Institute. These do take you away from MedlinePlus and onto those specific websites. So if you clicked on the cancer stat facts, female breast cancer, that take you to the National Cancer Institute page where you can start looking for statistics specifically for that topic. So you might use MedlinePlus as a starting point when you're unfamiliar with a particular disease or condition. It can also be a great starting point when you're not sure who might produce statistics on a particular topic. So I want to pause here and see, does anyone have any questions about the two portals that we just looked at? Okay, and I do see one. Benchmark data about various health conditions, and it's frequently challenging to look, especially at the regional, state, local level. I would go back to the stats of the states. I think that'd probably be a really great place to start because you can find all sorts of things. I don't know exactly what they might be looking for, but that will have specific state by state information. Again, through NCHS or CDC Wonder, I know you can get really, really far down to like the county level and local level. So CDC might be another good one to try and find that that really localized information for what they're looking for. And Sean might be going over some other portals too that will be able to help find some more of that state and local information too. All right, Sean, I'm going to stop sharing my screen so you can take over.
Okay, thank you, Katie. Yeah, thank you so much for coming to this, and I'm going to move on to talking about some national statistics resources. I'm going to start with two resources. Both of these also allow you to drill down to the state level, allowing you to compare national and state information. So I'm going to start with the Behavioral Risk Factor Surveillance System, or BRFIS, which is sponsored by the CDC and other federal agencies. It was first conducted in 1984 and has become the world's largest continuously conducted survey system. It collects data from adults 18 years and older about health risk behaviors, chronic conditions, health promotion activities, and preventative services. Those sponsored at the national level, the surveys are conducted at the state level, with all 50 states, the District of Columbia, and U.S. territories overseeing thousands of interviews every year. And the data was collected just through landline phone surveys, but as the technology and culture has changed, they now utilize a mixture of different survey formats, including cell phones, mail, and internet surveys. So I'm going to switch on over to the home page. Second. Okay, so here is the homepage for BRFIS. So there's several different BRFIS questionnaires. They all consist of a set of core questions, but they may have different optional modules, and each state also can add their own questions. So it can vary at the state level while having a core that is unified across the different areas that are administering the surveys. So if we can start by exploring the different Burfus questionnaires. If you go by questionnaires by year, you can explore the different survey questions that are offered each year, and they do vary by year. You can also look at the optional data modules by state, which will tell you how the surveys varied across the states that it was being offered. So now that you know how to look into what sorts of questions were being asked, if you go back to the homepage, you can look into the actual results. So prevalence data and data analysis tools is how you're going to get into the actual results of the survey. And then go into prevalence and trends data. So this gives you options to explore by both location as well as by topic. So I'm just going to you can select by both broad topic as well as subtopics if those exist. So I'm just going to go by fruits and vegetables, and then subtopics like and then like fruit consumption, and then just hitting go. So in this here, it defaults to a map that will give the prevalence here of the result for their question of, you can read here exactly what the question of is, how many people consumed fruit less than 1 time per day? So here you can see that it goes from 48 to 56%, and then the ranges go up here. You can also switch it over to a bar graph if you want to see it like that. Here, as well as in tabular form. And then if you scroll all the way to the bottom, this gives you some more information on notes, some more information on the data that was collected, the data source. Sometimes they do collect data that is not from the surveillance system itself, as well as measure definitions. And then the last thing I just want to point out how you can access the data. If you go to survey data and documentation, you can get information through the data user guide and the survey data and documentation on how to download the data. Okay, so now I'm going to go talk a little bit about our second national resource, and this is going to be State Health Facts. So this is produced by the Kaiser Family Foundation, which is a nonprofit organization focused on major healthcare issues in the United States. The organization's legal name is the Kaiser Foundation, but they refer to themselves as KFF to avoid any confusion because they're not technically a foundation. And also, more importantly, they're not associated with Kaiser Permanente, the healthcare company. So you'll often see KFF on their website or on publications or publicity that they do. So this resource provides statistics on more than 800 health indicators and a variety of information focused on health insurance and health care. This data comes from a wide variety of sources, including KFF reports, public websites, government surveys, and private organizations. So I'm going to switch over to the page. Okay, so this is what the homepage looks like. If you've used this before, it has relatively recently been redesigned. It used to have the homepage start with a map of the United States, but now it starts with a search box where you can immediately start searching by keywords. You also can browse the topics just by starting to click and explore that way if you don't know exactly what you're looking for, or you don't know what terminology they used specifically. So for this example, I'm going to look at some recent COVID-19 statistics. So I'm going to click on the COVID-19 box. Under COVID-19 disparities, I'm going to do COVID-19 deaths by race and ethnicity. So it starts with a table that breaks it down by state, as well as different racial and ethnic groups. You can also switch over to a map, which will allow you to it defaults to whatever you have filtered onto the left. So this starts by white % of deaths, and you can select by other race or ethnicities. And then if you scroll down, you can see here where they're getting their data from, as well as any other additional information about the particular measure that they're displaying. You can see that this comes from an analysis that the KFF did on provisional death count from the NCHS. All right, so now going back to the main page, one of the useful things that the state health facts can do is it allows you to create custom state reports, as well as comparing states using these. So I'm gonna, if you scroll down, you can start a custom report. And here I'm going to do one that's looking at alcohol-related numbers for the Northeast. So this is something that, again, you can search or you can click through. I'm going to click through mental health and substance abuse, alcohol and drug dependence, individuals reporting alcohol dependence or abuse in the past year. And then I can select states. So I'm going to do all the ones that are covered by NNLM Region 7. So let's make sure I don't miss any. Connecticut, Maine, Massachusetts, New Hampshire, New York, Vermont, and Rhode Island. Forget anybody. And then generate report. And it gives you a report with the indicator that you selected. So individuals reporting alcohol dependence or abuse in the past year were broken down by the states. That allows you to compare across. And whatever breakdown that the measure has built in is what it will display. So here it's broken down between teens and then adults age 18 plus. You can download the data as an Excel spreadsheet, which allows you to manipulate the data or use it for further analysis. And you can also share a link to this custom report as well. So I'm going to pause here and see if there's any, check if there's any questions in the chat. Just see. Detailing medical issues involving medical devices. I'm not sure. Oh, okay, I'm gonna go 1 second. I should have stayed on the KFF page. I'm just gonna go back to that 1 second. So I think I can do these questions quickly. Okay, so first the state custom report. I found that I started by the state health facts page, and then I scrolled down to explore custom state reports and then hit start my report. And then does this have medical devices? I'm not sure. I can see medical. So this looks like it is not, it has information on Medicaid benefits involving a couple different medical devices, but I'm not immediately seeing other statistics on medical issues involving medical devices. Oh, and Minka, thank you for providing that direct link. That's very useful. Okay. Thanks for those questions. I'm going to move on to our next set of resources, which is local statistics. So we've got 4 to look at, and the first one, most people should be familiar with, U.S. Census Bureau. So this is the federal government's largest statistical agency. It's part of the U.S. Department of Commerce. It collects facts and figures about a wide variety of information about America's people, places, and economy, and this, of course, includes medically and health relevant data. And this really is one of the resources that allows you to get down into very granular levels. This goes from state all the way down to the census tract level. And health statistics that you can find crosses things like disability, fertility, health insurance coverage, health business of healthcare, so availability of healthcare providers. And this data doesn't just provide information from the census. The U.S. Census Bureau also conducts a variety of other surveys. A major one is the American Community Survey, which is conducted annually and has a bigger focus on community needs. So I'm going to switch over to that page. So the U.S. Census Bureau is another resource that was very recently redesigned. So if you've used this before, it might look a little bit different from what you're used to. Similar to how a lot of places are moving, when you open the page, what you see first is your search bar. So if I'm gonna start out and I was interested in something to do with the environmental determinants of health, and I wanted to know what % of people in Pittsburgh live below the poverty level. I could start by typing in Pittsburgh and then poverty and then search. Then at the left, it really breaks down exactly what the search is showing me. It's looking at poverty and then Pittsburgh City, Pennsylvania. And it tries to kind of intelligently guess what you're looking for, and that will give you kind of a top line number, and then you can select other tables, which is how information is collected and displayed that are relevant to your search. So if I wanted to view this result of this top line result, it will show me the full table that is then filtered by poverty as well as the geographic location. And if you scroll down, you can see how this gets broken down by a lot of crosstabs. That's one of the really great things about this, about the U.S. Census information, is it really does collect a lot of information on people. So it allows you to a lot of breakdowns. So you can see poverty by educational attainment, by employment status, by a lot of measures that other sources won't necessarily have access to. And then if you scroll to the right, you can get down from the raw numbers down to the percentages. And if you want to find more information about the particular data that you're looking at, you can clicking on the notes gives you more information about what was collected, explanation of symbols and abbreviations. Similar to a lot of these, this allows you to export the data in a variety of different formats: Excel, CSVs, and as a zip file. So now I'm going to demonstrate the advanced search quickly. So I'm going to search for a zip code. You go to advanced search, you can find a filter, and you can search by any of the variety of filters that they have, or you can click through and browse. Just going to use 90210. So one thing about zip codes is that when you're looking at it, or when it's used to cover a geographical area, you'll often see the abbreviation ZCTA, and that stands for zip code tabulation area. These are geographic entities that the Census Bureau designed that correspond with zip codes. Because zip codes don't always exactly align with a geographic area because they're designed for postal service delivery routes. So they don't always work very well when they're in areas where there's not roads or similar factors like that. So click on this, and then when you're doing filters, you often have to click on one of the tabs up top for it to populate. And then this will bring you to a filter for just this particular zip code. If you click on the profile, so all of the geographic areas of the Census Bureau has data for has these profile pages, which contain summary information for a variety of different data points. So if you scroll through, it has a lot of top line information. It breaks down economic factors with graphs that allows you to select different options for the data displays. It sometimes doesn't like to load. And this allows you to look at state level, at the zip code level, at the census tract level, at really all of the different levels. But one thing about the census site is that the census collects so much information that it presents in so many different ways that there's no way to cover it in a meaningful way in the amount of time that we have. So I want to direct you to one of the aspects of their help page, which is, so if you go back to the home page and under help, and then if you hover over data and maps and then go to Census Academy, this is a really great resource hub for learning more about the census.gov. It has both really short data gen videos, which are short, few-minute long videos that are about a narrow topic, as well as more in-depth courses, webinars, and tutorials that get more into the weeds about how to make the most of what census.gov offers. This allows, this is if you want to learn more about what zip code tabulation areas are, this is the spot where you can learn more about that. Okay, so I'm going to move on to our next resource. The accounting is going to be for the county level. County health rankings and roadmaps. So this came out of a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. They are, again, really focused on the county level, and they try to provide a snapshot of a community's health over time, pulling together data from several sources, including BRFIS, and some of the other sources that we've talked about today. So we're gonna be focusing on the statistical information that's available today, but an equal focus of this resource is enabling people to act on what they'll learn. So if you look in other parts of the site that we're not focusing on today, you'll find collections of strategies and evidence-based ideas for improving local and community health. I'm gonna switch over to county health rankings and roadmaps. So from the main page, if you want to start digging into the health rankings, click on Explore Health Rankings, and then Overview. This allows you to start by searching by county, state, or zip code, or you can go by topic. We're going to go by location. So if you go for Washington, for Washington State. So in here, what you have is a map of the state of Washington, and the map is broken down by county and then colored based on their health outcomes measure. So this is a measure of how healthy they believe the county is right now, and this is a mixture of, if you scroll down, length of life and quality of life. And then it breaks down what they mean by both quality of life as well as what factors go into length of life. Then if you scroll up, you can select down either any of these sub factors specifically. So if you want to look at how the different counties measured by the measure of poor or fair health, and this is a reported measure. You can see that there. Or if you want to scroll down, you can look at the second main measure that the county health rankings looks at, and that is health factors. So, and this is split across, made up of 4 measures. This is health behaviors, clinical care, social and economic factors, and physical environment. And these are looked at as determinants that feed into the health outcomes that are being measured in the previous measure. So these are things that could be focused on to modify that then would then have an impact on improving, or if they're impacted negatively, decreasing the health outcome measure that was shown before. You can switch from the map to the rankings view. It defaults to ranking it by alphabetically. You can also see what the county with the best health factor ranking is, as well as the lowest health factor ranking is. So if you click on, if you want to learn some more information about a particular county, you can click on a county. So if I wanted to learn about Douglas County, you can click on more data for Douglas County. And this shows how it breaks down in terms of health outcomes as well as health factors. You can look at the county demographics, and it gives a county snapshot where it breaks down the different health outcome and health factor measures that I talked about just a moment ago for both the county, the state, as well as the country as a whole. One of the interesting things that this site does is it also shows trends for some of these measures, and that's indicated by this little symbol here. If the symbol is green, that means that this measure is improving. If it is yellow, that means it's staying the same. If it's red, that means it is declining. So if we click on it, this gives a lot more information about that particular measure. It gives more a definition of it, so years of potential life lost before age 75 per 100,000 people. It gives some of the potential causes for the measure, gives the sources, it gives links to the measure's method and limitations. It gives trend over time, as well as a comparison trend to the nation. And similarly, you can also download this data. Okay. And then one last aspect that I want to show about this is that you can compare counties. So if you go back to the main page and you scroll down, you can go to compare counties. So if you want to, if you select a state, so I'm going to go back to Washington, I'm going to select a county, Clark County, do go. So it starts off, it gives you a list of all the measures that county health rankings tracks. You can add a location. So they always select a number of counties that they determine as peer counties. So these are ones that have comparable demographic, social, and economic indicators that you can select from. around the country as well. And you can also select any county that you would like to compare. So then this allows you to break it down. And you can also select and compare for these measures that have the trends. You can compare the trends. And then you can compare up to 4 counties if you would like. And now I'm going to move over to our next resource, which is City Health Dashboard. So this gets all the way down to the city level, as one would expect. So this comes from the Department of Population Health and the School of Public Service at NYU, as well as the National Resource Network. This focuses on health in U.S. cities, as more than 80% of the U.S. population lives in urban areas. So this started out as focusing only on the 500 largest cities in the U.S., but a couple of years ago, it expanded to include small and mid-sized cities that have populations over 50,000. So it currently covers 906 cities. So they cover 36 measures, which overlap pretty similarly with those with the county health rankings and roadmaps. So it really kind of varies on how far down you can get some of the data. Some of it goes all the way down to the census tract level. Some of it is at the city level. You have to check the indicators which you're interested in, and this really depends on where they're getting the data from, because they source it from a variety of different locations. So I'm going to switch over to that page. Okay, so city or so I'm just going to go through this very quickly because I just noticed that I've been talking a little bit longer than I'm supposed to. So if I was gonna, you can start by city or state. If you don't know what the cities are in your state that are over 50,000, you can just start by typing in the state and it will filter that for you. So if we wanted to look at Eden Prairie, Minnesota, it gives you a list of all of the different metrics that they are covering. So if we wanted to look at diabetes as a health outcome, it shows you where this lies across the country, with this being the city value, and then the triangle being the city average for the nation. If you scroll down, it gives a map. This is a measure that is available at the census tract level. You can hover over to get that data there. You can click on it, have that highlighted. You can also look at, if you click up top on the demographic detail, if the demographic data is available, it will break it down for that metric. That's not available for diabetes. But you can go back to metric detail if that is the case. So similar to county health rankings, you can compare cities, where you would similarly compare the diabetes rate between Eden Prairie, Minnesota, and Hoover, Alabama. And then I'm going to quickly go through our final resource, which is Rural Data Explorer, which is a nice counterpart for this most recent resource because it focuses on rural data. This is funded by the Federal Office of Rural Health Policy, and it serves as a national clearinghouse on rural health issues. There's a lot of valuable information on the site. including a data section that contains health statistics of interest to those living or working or interested in rural areas. So I'm not going to demo this one because even going into this, I knew that there was a lot to cover in a short period of time, but it is pretty easy to search. From the home page, you can access the statistics by selecting Rural Data Visualization right up at the top and then clicking on Rural Data Explorer. You can use the drop-downs to select a variety of measures and metrics that are of interest to rural areas. If you would rather, you can scroll down and you can select on the map on the map to start at the geographic level rather than at the metric level. And you can compare different counties. So you can compare metropolitan counties to non-metropolitan counties and rural counties to each other. So we don't have enough time to kind of talk through the second part of this guided exercise, but if there's kind of a little bit of a take home, you can exercise the knowledge that you've learned about these varieties of sources for health statistics by thinking of which of the resources that we talked about might be the best to answer the question that you started with at the beginning of this webinar. Look into it, see what results it gives. Does it answer your question? Might you need to go back and search another resource? Might you need to dig deeper into the metric that you found? That is our talk. Thank you so much for coming.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.